this is Jessica Ortner, and I have a treat for all of you. We are interviewing a woman who is making waves. Her name is Dr. Lissa Rankin, and she just came out with a new book called Mind Over Medicine, all about the science behind how we can heal ourselves. So in this short conversation, we're going to talk about tapping and also your doctor and what you can do to make sure that you're getting the best care. Welcome, Dr. Rankin. Thanks for being with us.
Oh, it's a pleasure. Thank you for having me.
Well, this is the tapping solution, so I have to start off by asking you about tapping because people are getting such great results with different physical ailments. And the thing that's crazy about tapping is so many people write in, they said, it's helped me with my headache, it's helped me with my knee, with my back pain. And for someone who hasn't tried tapping, they're going to be skeptical because they think, how can one modality help so many different challenges? So from a doctor's perspective, what is going on when people use tapping or other stress relief techniques? What's going on in the body?
Well, here's the thing. The body is equipped with natural self-repair mechanisms. So when proteins break or we make cancer cells, we all make cancer cells every day. When infectious agents come into the body or even just the process of retarding aging, the body knows how to do that. But this was a revolutionary sort of shocker to me when I was doing this research, is that the nervous system has two ways of being. One is the sympathetic nervous system, or sort of the fight or flight, what Walter Cannon at Harvard called the stress response. And the other is the parasympathetic, which is it's the relaxation response. And so what I didn't realize is that those natural self-repair mechanisms only work when the relaxation response is activated. But we have more than 50 stress responses per day.
Wow.
So from a physiologic perspective, what happens when you're tapping is that you're activating that parasympathetic nervous system. So the body that knows how to fix itself has been deactivated because we've been in stress response. And by shutting down those stress responses and moving us into the parasympathetic nervous system, the body can start to heal itself. So people might be tapping for stress relief or because they have stage fright or whatever other reason, and all of a sudden they're like, wow, I have this magical health benefit. And that's why. I actually had I was taking 7 medications for a whole host of chronic health conditions myself by the time I was 33. Wow. And I'm now down to half the dose of one of them. And part of my own personal prescription, I write all about in the book, I write about making your own diagnosis and writing your own prescription. And I include in there Lissa's personal prescription, and part of it was EFT.
Wonderful. Well, I like what you're saying here. It's not like some magic technique that heals you. It's that you're allowing your body to do what it's meant to do, which is recover and heal itself.
That's right. You're just reactivating what your body already knows to do, but we've forgotten this.
Right.
And unfortunately, in the healthcare system, we've sort of lost respect for the body's ability to heal itself. It's almost a narcissistic wound for doctors, I think.
Right.
We want to be able to believe that, like, we went to school for 12 years because we know your body better than you do. But that's not the case. Your body actually knows what it needs best, and the best thing you can do is help it do its own job.
Well, you were practicing medicine, your doctor, for 11 years, and now you've chosen a different path where you're really doing your best to revolutionize the healthcare industry.
That's my mission.
That is your mission. So I want to hear about the motivation that's led you to here. What happened? I know it's a lot of things over time, but was there a moment when you realized there's something wrong, there's something flawed, and I want to do something differently?
Well, it was a series of moments. You and I were talking earlier about the night of 4 dead babies, where I had to deliver 4 dead babies in one night, and I was just, crying on the floor of the locker room by the end of the night, and my teacher in residency was screaming at me saying, "Buck up, Rankin, you got to get a thicker heart." And in reality, I think the solution is just the opposite. We need to get back into our hearts in healthcare. So I'm now teaching doctors in a program called the Whole Health Medicine Institute about how to open our hearts, how to facilitate the patient's natural self-repair mechanisms, and how to bring everything that we know in Western medicine. We've done some genius things, but how to bring them into partnership, so that the patient can help get to the root cause of whatever is underlying their illness and write for themselves the prescription of what it's going to take as far as reducing the number of stress responses in the body, increasing the number of relaxation responses, and that can include adding tapping.
So this is interesting. This isn't a battle against traditional medicine and doing the holistic, but this is being more having an integrative, looking at our body, looking at ourselves in a holistic manner, which means as a whole, and looking at all these different aspects.
That's why I call it whole health. because it's, absolutely diet and exercise and taking your vitamins and all of that are important, but that's only a small percentage of your health. And I include all the data that shows that it's equally, if not more important, to have healthy relationships and a healthy professional life and a healthy spiritual life and a healthy creative life and a healthy sex life and a healthy relationship with your money. And all of those things affect the body by affecting stress responses and relaxation responses in the body. So that's what I mean when I'm talking about whole health. So it's not even, to me, when I think of holistic even, I'm thinking of, instead of taking drugs, you're taking supplements. But that still suggests that the answer is outside of you. And from the data that I found, for example, loneliness, people who suffer from loneliness, they have twice the risk of heart disease of people who aren't lonely. Wow. And yet, when was the last time your doctor prescribed for you, alleviate your loneliness?
Yes.
Those are super important.
So for somebody that's, they're watching this and they have a health concern on their own, how can they figure out what's underneath it, what's the emotion, or what else they can do? I know you wrote an entire book about what to do, but if you would give us some kind of tip, something that we can think about right now that could help us see a shift.
Well, there's one question that I found super important with my patients, and that is, what does your body need in order to heal? So what I found is that people are incredibly intuitive. They have this voice, I call it your inner pilot light. That's like your inner doctor. And it's this voice of truth that's the opposite of the voice of what I call the gremlin. It's that fear voice that says, you can't do that. Like, oh my God, I need to quit my job in order to reduce stress responses in my body. And then the gremlin says, but you can't do that. How are you going to pay the bills? Or I need to get out of this toxic relationship. And then the gremlin says, but you can't do that. But if you actually learn to listen to that voice of the inner pilot light, when you ask yourself, what does my body need in order to heal? It's amazing how much people already know. So I encourage anybody watching to
I love it. So really trust yourself, because we put so much trust in doctors, and again, rightfully so in certain situations, but we often undervalue our own intuition.
We give our power away. It's a type of, Martin Seligman calls it learned helplessness, where we become very passive about our health sometimes. But the reality, when I was doing all of this research, I was talking to my literary agent, and she said, Lissa, before I read all of this stuff, I honestly thought my body was none of my business. That my body was my doctor's business, and it's just like my car. I go and I give my car to the auto mechanic and take care of it and then give it back to me when it's done. And she said, after reading this, I realized my body is my business, and it is.
Absolutely. Yeah. Well, I asked my Facebook community whether they had any questions for you, and I had this great question from Claudia, and she wrote, please ask her, where can we find the doctors that are positive and support us, like she writes about in her book? So again, if we do want to go to a traditional doctor, how do we find someone that is not just giving us that quick 12 minutes in and out?
Well, first off, I'm training them. So
good. Thank you. Thank you.
I'm certifying doctors. Right now I'm working with 16 doctors, and we're expanding the program in 2014. It's called the Whole Health Medicine Institute. And they're all on board. They're like the most amazing physicians.
Yeah.
But there are many out there. We actually just started a website, healhealthcarenow.com, as a community forum so that some of those patients and doctors that are aligned with this mission can find each other, because things are revolutionizing in healthcare, and there are doctors. But I really recommend that people not be afraid to question and interview their doctors. So
it's like a date.
Totally. And don't be afraid to get a second opinion. If you have one interview and it doesn't go well, for example, one of the things I talk about in this book is it's super important that your doctor believes you can get well. So if your
Interesting. I never thought of that.
It's super important. That's why in the clinical trials they do what they call double-blinded, because if the doctor knows that the patient's getting a sugar pill or they know that they're getting the drug, they're biased, and their bias actually affects outcome. So your doctor's bias will affect your outcome. You wind up sort of transmitting it by osmosis into your own belief system, and your beliefs affect your amygdala, and your amygdala affects your stress responses and your relaxation responses. So it's super important to know that your doctor's on board and believes as much as you do that you can get well. So when they use words like chronic or incurable, and they tell you you're going to have to take drugs for the rest of your life like they told me, well, how do they know?
Yes. Absolutely. Yeah. Do you feel that things are changing? Are you finding more of your peers, more doctors becoming more open-minded, or are you seeing a lot of resistance to this?
You know, the younger generation is so different than the older generation, but even the older generations, many of them are starting to shift. I'm very hopeful.
Yeah.
I love, did you see Tom Shadyack's documentary, I Am?
I didn't. I haven't.
It's so good. But anyway, there's a scene in there where he talks about how when animals decide to switch watering holes, it starts with a shift in consciousness. And they all sort of decide to switch watering holes. And when 51% make that decision, then the rest come along. Wow. So I sort of feel like we're getting close to that 51%. And it's just going to take that last shift for other people to come along.
I think we are, and consider me part of that 51%. And I know a lot of people that are watching. I'm such a fan of yours, and you know, this is a wonderful book, but all the things that you're doing behind the scenes as well to really make a difference. There's one thing to complain about the system, but it's another thing to actually do something about it. And I really appreciate all that you're doing.
Oh, thanks.
So
well, it's going to take a village. It really
it's going
does.
to take a village. I'm on your team, and I hope that everyone picks up this book. It's Mind Over Medicine. It is a fantastic book. Thank you so much for being with us.
Thank you. It's a pleasure.
Now we want to hear from you. Do you believe that your emotions and your thoughts impact your health? Do you think that you have the power to heal yourself? Let us know in a comment below, and you will have a chance to win a free copy of Lissa's new book.